There's loads of BS when it comes to the therapeutic industry, and I encounter all sorts of crazy beliefs from patients that have been propagated by other chiros, physios, and healthcare practitioners. One of my biggest frustrations is having to dispel myths around manipulation and chiropractic adjustment to patients. Does this mean that these things don't help people or can't help people in pain? No, of course it doesn't. What it does mean is that bullshit explanations for why these things work can and do create harm in patients that lead to a fragile mindset around pain and injuries that ultimately can cause long-term harm. In this video, I'm going to dispel those myths with scientific evidence to back it up. Let's go. So myth 1, manipulations are effectively putting your joints back into alignment. Oh, the old pelvis is out of alignment. Just need to get it clicked back in place. Contrary to this common belief, manipulation does not alter positions of the joints or reverse so-called subluxations. Evidence supports the fact that manual therapy produces a non-specific neurophysiological effect that modulates pain and muscle tone via the central nervous system. Myth 2. In order to be pain-free, you must have normal spinal biomechanics and joint mobility. There's no such thing as normal spinal movement. There is a large variability among the population with no pain, and this has been shown in studies on both the back and also on the neck. Studies also show that we use a relatively small amount of our full spinal range of movement when we're doing daily activities, bending, lifting, etc. So it does not make logical sense that one slightly stiff segment would be the culprit for all of our pain. Myth 3, a therapist needs to find the problem joint and be specific about their treatment for you to recover. The studies have shown that not only do therapists disagree with which segments are actually the problem with the same patient, it also makes no difference if you do a spinal manipulation on one specific joint that you think is the issue or a more global technique. Studies showed that manipulation directed to randomly selected segments of the spine were just as beneficial as those where the therapist directed the manipulation to the segment that they thought was the issue. It also doesn't seem to matter if you manipulate away from the painful area, you still get pain relief. So this would be like manipulating the middle of the back for neck pain or lower back pain and still getting pain reduction. If it truly was about the specific joint in the area of your pain, ask yourself, how could this be so? Myth 4, you need to hear the almighty click to get the benefit. The old YouTube therapists love a little click, probably why they use this cable that makes a click itself. Placebo. Studies show that an audible click called a cavitation when performing manipulation appears to be totally irrelevant to the person getting better. You can get better just as much if there's no cavitation as if there is. Myth 5, manipulation is necessary in order to reduce pain. Systematic reviews have shown for both the back and also for the neck that manual therapy applied based on motion palpation and independent exercises were equally effective. No difference between the exercise group versus the manipulation group. So exercise can be used to treat patients with these conditions with equal effectiveness. You also get the secondary benefits of exercise being good for you in many other respects. Now, does this mean that manual therapy should never be used? Again, no. But what it does mean is that it's a myth that it is absolutely necessary in order to get recovery. Myth 6, there is a magic fix to your chronic neck, back, or spinal pain. All of the above studies and myths add up to the fact that although manual therapy can help to modulate pain, there is no one technique that seems to be superior to others, and no evidence that the actual technique involved has any great relevancy. So there's lots of different techniques that people use for the same benefit. And this is my main bugbear really with YouTube therapists and using massage guns, hammers, Y straps and the like. It's basically got a huge placebo effect, and the same effect could be made without the theatrics that often comes with this sort of therapy. You don't need to do these theatrics to get pain relief. But what it also does, it reduces the locus of control in the patient. Locus control is the feeling that you're in control of your body and your pain. The less you feel able to control your pain, the more you will rely on chiros and physios and other things, thinking there's a magic fix for you because you can't take control of your own symptoms. And that's going to give you less likelihood of long-term resolution to your symptoms. So don't get caught up in this cycle of BS and understand that there are lots of things you can do to control and help your pain long-term with far more effectiveness. If you want to learn about these things, then check out the video that I've done on this up here.